I'm excited to talk to you about another project that CROSH has been leading entitled Northern Ontario Community Immunity Series, Answering Questions to Gain Vaccine Confidence. And this particular project was initiated because NSERC, the Natural Sciences and Engineering Research Council, put out a funding call to anyone who thought that they had some ideas on how to communicate messaging to Canadians, to help answer their questions and to give them the confidence that they needed to get vaccinated against COVID-19. And so for those of you who don't know, maybe a little history on CROSH. CROSH is the only Centre for Research in Occupational Health and Safety that's located in Northern Ontario. And our mandate is to serve workers and workplaces predominantly that exist in Northern Ontario and help them solve problems to their solutions. And part of the reason why we get support funding from the Ministry of Labour and Training Skills Development, and part of the reason for that is because we recognize that Northern Ontario has benefits and risks that are sometimes different from what you see in larger urban centers, particularly if we want to compare, which we typically do, to Southern Ontario, right? And so, not to say that this is a complete list, but typically things that create challenges or differences for us are some of these points here, which include our geographic isolation. So we do tend to have communities that are smaller in population size straight up, but in addition, when you start looking at the distances between communities, it's a lot greater. And so I think often Northerners feel like it's a smaller town or smaller community because those geographic distances change the way we interact with each other and how we work together and how we see our world. Another, difference is that typically in Northern Ontario, there tends to be a reduced workplace diversity. And what I mean by that, in some communities, there may really be, only a handful of workplaces that employ the predominant number of people in the community. And certainly we also tend to be resource-based industry heavy, right? So you'll see a predominance of mining, forestry, pulp and paper, manufacturing, transport as core employers for workers in Northern Ontario. Although I should also say that certainly healthcare and government are also top employers for our communities. And altogether, and people would agree that our cultures, values, beliefs tend to be a little bit different. And so as a center, we strive to incorporate those things into our work, but also as a project, we felt that, we based the approach on these principles. We believe that Northern communities are unique. We believe that a community-based approach is a more effective method to address the specific needs of the community. And we also felt that, if you're trying to frame a message, you need to do it in a way that aligns with those community needs and reflects those community values if you want to actually have uptake of that message and maybe it affect an actual change. These were kind of the key considerations that we had as we approached the project. First, providing correct information is not enough to change behavior. I think we know that. We also know that we listen to those who we trust. We should be perceived as nonpartisan. And we need to remain respectful at all times. Another sort of guiding principle or key consideration was that we recognize that our communities tend to be broken up into these 4 core groups, where sort of on the one end of the spectrum, we have very energetic people that are either, vocal supporters or vocal resistors of the vaccine movement. And sort of on the other end, we have a group who are passive supporters or passive resistors. And we felt that probably at the end of the day, we weren't going to develop a set of materials that were going to equally impact all of these groups. And in fact, we recognized from the get-go that sort of the vocal resistors probably weren't going to really listen to us, right? Because the vocal resistors are most likely going to, if they're going to change their ideas or thoughts about it, it was likely going to be through a trusted personal individual or network. And so what we wanted to do was create materials that really gave the support that the champions needed, like referenced support. We also wanted to encourage our passive supporters to be a little bit more vocal, which doesn't mean standing at the street and yelling, but being willing to engage in conversations, maybe with these people, maybe with these people's, to share their thoughts. So sometimes, they're the more effective champion than the vocal champion. And then we also wanted to provide enough information for these people so that they had their questions adequately answered to feel confident. So the project goals were to increase the uptake of first and second doses across Northern Ontario communities by building confidence in vaccines, to maintain or strengthen trust between communities and public health units or professionals. And at the same time, we still wanted to maintain or strengthen trust between communities and CROSH. We started the project by engaging with our communities, and we did this on a number of levels. First and foremost, we created community profiles where we, identified the industries in the communities, the makeup of the communities demographically, the vaccination status and access to health and whatnot. And then probably the most important thing that we did was we interviewed teams from each of the health units across Northeast and Northwestern Ontario. And they were delightful to talk to. They provided us with a lot of information. They gave us real key pieces for our core strategies, and certainly connected back with them to give them all the information that we put together. We also conducted interviews with community leaders. We did outreach to MPPs within all of the districts, and talked to many of them and other suggested leaders. We did outreach to individual workplaces with a mixed level of response. And then we took all of the information that we collected from those things, and we created themes. What were the common messages that came out from all of those interviews? And from that, we basically created our, I put up just to give you a sense of the types of questions that we asked people. This isn't the actual survey. I just want to give you a flavor of the questions without going through everything. But so, for example, can you describe the vaccination strategy in your community? What were barriers that people faced? Were there any incentives? Were there barriers specifically to workplaces? What do people tell you are the reasons why they're delaying getting vaccinated? Any specific concerns to your community, and are there any, real successes that you've seen in your community? And so to give you a flavor for some of the results, I put some of the comments from successful messaging. So anytime the message is, let's take care of each other, seen trusted community leaders getting vaccinated. It's not just about you. This is about your community and the concept really of the love for your community. And also this, bring the vaccines to them, right? And actually, when we developed the logo for this project, we tried to reflect that. It was a community immunity series, and that we're a forest of individuals that could protect the vulnerable within our communities. Likewise, some of the barriers, we've never had any outbreaks here. Fewer people, low access to outside communities, so feelings of safety or it won't happen here. There were some, negative feelings around government or large industries. So one statement was, this is a pharma play to make money. Access, particularly around work and shift and the distance to where the vaccines were taking place, and lack of access to materials in French. So once we collated all of our information, we identified 7 themes. Here are the 7 themes that we created. Don't have too much time, so I won't read through each of them, but I'll talk to you a little bit about what we did with them. So for each theme, we as a team sat down, usually a half day or a day for each, and we sketched out how do we answer this question? What's the sequence of logical information? What kind of illustrations can we use to reinforce the messaging? And maybe it's for us, we had to have it all kind of written out and whiteboarded as the first material that we were going to create for people. And so the first one was done as a pamphlet type format. One of the things that we felt was really important, and you could see it from the barriers as well. It's like there's a lot of misinformation out there. People are concerned about the reliability of the resources, so a lot of effort was put in by team members to make sure that anything that we said in the documents were not only referenceable, but they were referenced by respected, trusted community organizations, predominantly Canadian. All of our documents have the references available, but we also put in effort to create the QR code so that if you go to this QR code, it will take you to the references for that document, and the references have embedded links in them on our website, so it will also take you directly to the source. We were hoping that would give our champions, the arguments they needed at their fingertips. We certainly don't think that everybody wants to read our documents, and so we made the documents in multiple formats, including posters and placemats. We made videos, and we also made podcasts for people who prefer to sort of listen rather than read. We certainly translated all of the materials into French. We also did some training for our people to make sure that they had the tools needed for engaging. We were not as able to engage as many workplaces as we wanted to because of the constraints around interacting with people during a pandemic. And so most of our exchanges have been after the fact, providing the information to people. And we've done a lot of work now. The project is done in terms of content. We've done a lot of work to give it back to everybody. And certainly if anyone wasn't aware of this project already, it's free. It's available on our website in all of those formats. You can download it. If you want a hard copy of anything, we will provide it. You simply have to email and ask us for it. And I do want to take a quick minute to just say thank you so much to this team. They did a lot of work in a really short period of time to pull this together. You can imagine we got the funding in June, and we needed to launch all of those deliverables for the fall. Toby Mankis, our Science Communication Officer, Courtney Lessel, CROSH's Research Associate, Dr. Berrio with the Science Communication Department, Dr. Godwin, that you just met a minute ago, Associate CROSH Director, as well as the Faculty of Health at Laurentian, Dr. Reed, who is also with the Science Communication Program. And we also had 2 students involved in this project, Maria Fredrickson, who I believe is here today, so you can congratulate her. She did all of the translation and a large amount of outreach to particularly small businesses in the area. And Cass Crane, who is actually continuing this work with Science North as they go into communities, trying to also educate people. And she was involved in the early training of the project too. So I know I'm out of time, acknowledging NSERC for the funding of this. And if we don't have time for questions, I can certainly answer them directly in the Q&A box. It's 12:55.
Minutes for questions.
Yeah.
Absolutely. Okay. So excellent. Thanks for an awesome presentation, Dr. Dorman. Our first question, will vocal resistors also change their opinion direct family get ill or die? For example, an anti-vaxxer's mom who dies of COVID, will they be more likely to change their mind as opposed to listening to someone who has told them that they should take the vaccine? That person being a close friend.
I mean, that's going to be a very individual answer, right? I've seen, as probably many of you have seen, a number of people in the news who were vocal resistors, who then came down with the disease and then were trying to encourage people to get vaccinated. But at the same time, you're also hearing a lot of messaging that even when, even if a person becomes ill with COVID-19, they often still don't believe that that's actually what's going on with them. And I can imagine there would be some denial if even if a family member died, that's pretty traumatic. And so the easy answer is that there will be people who will never change their mind. And in fact, what the literature tells us is the more you try to convince them to change their mind, that's the exact thing that will convince them not to change their mind. And so that's not the approach. So I think one of the documents we created was specifically about how to talk to a loved one about vaccination. And I think if you've got someone in your life, and we all do actually have someone in our life who really is resistant, I think you have more success with the close, trusted person who comes at it more gently and from the side. So I do refer you to the sandwich questionnaire to help you.
Excellent. Well, that's all the time we have, unfortunately. But as Dr. Dorman says, she's happy to reply to her the questions directed at her in the Q&A section.